Hello and welcome to the November 2025 edition of Room for Everyone, the video podcast of the Rheumatologist. As we enter into the holiday season, there's a lot that we should be grateful for. We live and practice in an age in which many rheumatologic diseases can be effectively managed. A rare few can even be cured. For these individuals, they are fortunate to avoid progressive pain and disability that was once considered inevitable. Yet there are many who are, as of yet, unable to avoid that progressive disability. That's why addressing ableism is such an important aspect of our job as rheumatologists. Ableism, very loosely defined, as a set of beliefs or practices that devalue people with physical, intellectual, or psychiatric disabilities, is everywhere. In fact, it is so pervasive that we often overlook or forget, or unknowingly participate in it in so many different ways. This month's Ruminations covers the ubiquity of ableism, what we can do to combat it, and the benefits that a fair environment brings, not just for people who are at the receiving end of ableism, but for everyone as a whole. Certainly, it's our hope to stamp out disability, but that doesn't mean that we should inadvertently hold a position against people with disabilities. In fact, the best way to address disability is to create systems that make disability feel moot to begin with. There's also a ton of other great content within the pages of this month's issue, such as who are the incoming presidents of the ACR? Will Harvey, and ARP, Rebecca Cleveland. Why should we target B cells in systemic sclerosis? And how do rheumatologists within the AMA House of Delegates advocate for our patients and our specialty? That and so much more in this month's edition of The Rheumatologist. So please take a seat and enjoy all the articles here in The Rheumatologist. After all, at The Rheumatologist, it is always one for all and room for everyone. Take care.